Hello, everyone. Welcome to Organ India's Facebook Live. Hope you all have been doing very well. Few tragedies can be as devastating for a person as losing both hands. It can leave you dependent on someone else for the rest of your life. In India, the only recourse to life without hands was prosthetics. But all that changed on 13 January 2015. After a surgery that took over 16 hours, India's first hand transplant surgery was successfully carried out at the Amrita Institute of Medical Sciences in Kochi. An Indian patient received a double hand transplant that transformed his life. Today, we have with us the surgeon who pioneered the hand transplant surgery and paved the way for hand and limb transplantation in India. Dr. Subramania Iyer is professor and chairman plastic and reconstructive surgery, head and neck surgery and oncology, craniofacial surgery at Amrita Institute of Medical Sciences at Kochi. Welcome, Dr. Iyer. Thank you so much for joining us here today.
Thank
So
you
great
very
to
much,
have you.
Sunaina. Thank you very much. And it's a pleasure to be part of the Organ India movement always. And it has been always a pleasure watching you all work for this noble cause of organ donation. Yeah.
Thank
So,
you. Thank you so
yeah,
much.
thank you very much. Yeah.
So, Dr. Iyer, India's first successful double hand transplant was done by you and your team in 2015. It
Yeah.
was a huge development in the field of transplantation in India and in Asia, if I'm not mistaken. So, how did it all come about? How did you decide to do the first hand transplant as it was never done in the country before?
So now let me give our background. Our department's background is a composite department of plastic surgery and head and neck surgery all together. We have a large team of plastic surgeons doing a lot of reconstructive surgery, and we do hand surgery also. So the the issue of hand transplant was in fact a patient-driven one, because we had a patient who, a young fellow, 30-year-old, who was going to lose his both the hands because of fire, electrical burns. There was a huge burn on both his forearms, and then he came to us the next day, and then we found that the hand is getting gangrenous, and then so in fact, his hand would have just burned away, would have gone burned away, and then the only option to save his life was removal of his hand at the forearm level. And imagine 30-year-old young fellow, when you tell that the hands have to be cut off, it is difficult to tell. For even doctors, it's difficult to tell. Leg amputation is okay. We are all used to tell because of the diabetes and all. But hand is different. When you say that you're going to remove the hands, and then he was devastated. And then he was literally, but we had to force it. We had to tell him, convince him, because it was a question of life and death. And
Yeah.
so then he asked, what are the alternatives? And then we thought about prosthetic hands, and then we talked to him about that. And then the thought process of hand transplant also came into our mind, because we had read about it. Thought that we had been told that hand transplants were much better than the prosthetics. So that is the time. At that time, so we promised him that we will see. We have not started it. We think we are capable of it, and then we will look at it, and then for you we will prepare ourselves for being a hand transplant center. That is how it started. It was about 2 years prior to our hand transplant what actually happened. So that's how it started. It was a patient driven need, and then we thought we could do it.
Okay. And can you tell us a bit about the history of hand transplants? How many are performed globally? In India, when was it done first? Because 2015 is quite late. I mean, it's
Yeah.
other transplants have been around for a long time,
Yeah, yeah.
but hand is something new.
Yeah, into the hand transplant, initial successful hand transplant was done in US in 1998. Even though one case was done in France 1 year before that, we don't call it a great success because of some technical issues and all those things. But the successful hand transplant, which is still living, that is the in 1998 it was done in Louisville in USA. That is
Okay.
still working. That is
Okay.
the first hand transplant done. And then it it got caught up in France and Europe, mainly in France and Turkey, and then US, many centers in US, and some centers in China, one or two centers in China. So totally about 200 more than 200 transplants have been done across the world now. uh, when we started, it was the number was around 170, 164, 165 odd numbers. So after that, when we started in 2015, there was no, obviously no center had done it, and
Yeah.
after that we have another four centers capable of doing it in even in India. It
Okay.
has been about 17 cases so far which has been done.
Okay. And those four centers are, of course, yours in Kochi,
Yeah,
and one is in
One is in Global in Mumbai,
Bombay.
KEM in Mumbai, and Stanley in Chennai, and
Yeah.
Jipmer in Pondicherry. Five centers.
Five centers. All right.
And
Okay.
Armed Forces also, they are ready in Pune. They are ready for the
Oh,
transplants, but they are waiting for certain logistical arrangements.
right. So, I mean, obviously, the challenges are huge. It took so long for it to happen. Main challenge, I'm sure, is that getting donor hands.
Yeah,
So, initially, when you did the surgery in 2015, we got a lot of calls, and from people asking that, okay, we're missing one hand, we're missing one limb.
yeah,
Can we do the hand transplant surgery? Can you help us? So, and I remember at that time you told me that you will only do the transplant if both hands are missing.
yeah.
So why is that?
Yeah, I'll answer both of it. See, first part of the question was what was the problem with the donors? How you had to wait for the donors? That itself is a long story. And then, you know, I would say that that was the greatest obstacle for our first hand transplant. uh, we see when we started thinking about, I told you 2 years prior to this transplant
Yeah,
we started, technically we had to get equipped because we are all good microsurgeons and surgeons, and we our center was doing a lot of transplants. Our nephrologists were ready to support our immunological treatment. So we were institutionally, we are quite okay that way. We equipped ourselves by cadaver dissections, and we have an anatomy department. We went several times to do the cadaver studies and all those things. Then we had a lot of literature search, and then we had mock drills, we made lot of we spent a lot of time preparing ourselves, to get it. Then was the legal hurdles, like nobody knew about, even in the circles of the law, nobody knew about hand transplant. And we
right,
found that hand is not mentioned in our transplant act. So we
right.
thought, how do you overcome that? Was there was a clause that other organs can be done, other organs which comes under the province of the state. So we met the state health secretary and all those things, and then convinced them, and then they sent a inspection team. So they all found that we are okay, we are not, we it's a
Yeah,
just
that you can do it.
justified
Yeah,
issue.
yeah,
So that's how we got the permission. So once we got the permission, there was a problem, like we got a patient also, which I'll come, we the first transplant patient, second and transplant, they were all ready. In fact, the moment people knew that we are ready for doing the occasion. But the main problem was the uh, availability of the donor. The availability of the donor was a big issue in a way, because the hand has to be got from only a brain dead person. You cannot donate it, like liver and kidney you can have it from different people, but hands have to be taken from a brain dead person. And then uh, you imagine a person who is brain dead and the family agrees for organ donation. They know that if you remove the liver and kidney and all, there is only a small scar in
right.
the abdominal wall, right? Small scar, it doesn't. But imagine I'm going to ask them at that time, can I take the hands? The immediate reaction is that is something, it's not the right thing that I am asking that, which is unimaginable because nobody knew about it. And this happened several times. I had counsel personally about 4 families. They were all naturally reluctant, and then one family finally agreed for the donation. Was
And
this
how come they agreed? I mean, you had already,
yeah,
yeah.
it's again, as I told you, it will just go on my description, but it's interesting to
That's
know.
okay.
See, it's because I think the whole hand transplant movement of the country owed to that family. Because that is how it started. See, the person who donated the hand was part of a group of people who were helping people for a lot of things, socially active group. They were also picking up people from the accident site and bringing to the hospital and all those things. And this person got involved in a bike accident, and then he was brought to the hospital by the same group, same his
Hmm,
group.
hmm,
And then he was declared brain dead, and then naturally they themselves looked at the possibility of organ donation. Then this question of hands came, and then the description of this person was so much that what he was taking care of his invalid father who is paralyzed from hip downwards. He was taking care of that father for last 10 years, giving daily care and all those things. And when we saw later on, he was working as a glass painter, and his paintings were brilliant glass paintings, brilliant hands placing. And then, so when we broached the idea to the family, the well wishers, then they conveyed it to the family. And then when they knew that he's going to die, he's not going to be no more. And then when we asked for the hands, they said that, see, those hands are divine. Divine. It has been looking after that father for 10 years without anything. He never moved out of the house. So those hands, if it is going to be helpful for somebody else, it should not be wasted. So please go ahead.
wow.
That is how that first hand transplant happened. And I can say that again and again, only because of that noble deed, the hand transplant movement in India
Hmm,
started. Because otherwise we would be hesitating. Nobody would be, without a donor, it will never take off.
right, right.
Once this was done, and then the ice was broken, and then there was a precedent, then it is easier in a way. It came in the papers, obviously. This was
Right.
a
Everybody knew
unique
about it.
donor.
Yeah.
Yeah, it went over all over the country.
Yeah, yeah.
So
I told
that
you
was
we got many calls after that,
yeah,
asking,
yeah, yeah,
can you
correct,
do it?
correct,
Can you
correct.
do it?
Yeah,
Yeah.
correct, correct. And what was the second question? I forgot.
I was asking you that these people who did call us, who had maybe one hand
Ah,
who
yeah,
had
yeah,
lost
I got it, I got it. See,
even a
now,
finger, they wanted to know if they could get transplanted. So, I
correct,
mean,
correct.
how
See,
do you decide whether somebody gets, is a
yeah,
candidate for transplant or not?
yeah, yeah. Now the question is, see, hand transplant is like we just equate it to kidney transplants, because the medicines that are required to prevent the organ from rejected somebody else's, so naturally you need immunosuppression. The medications which you have to take is exactly equivalent to kidney, and they have to be continued lifelong. So, and these medicines have their own ill effects. They can make long term use, can make them diabetic, hypertension can come, and then it can have a lot of other issues also. And for kidney, it's a life saving thing, whereas for hand you cannot call it as life saving. It has to be something like a uh, life enhancing. But if you ask
It is life
anybody
saving. Yeah,
who has got both the hands lost, many of
right,
them are on the verge of suicide. So it is a life saving thing for them,
right.
but theoretically it is not. So, but if you put one finger or one double hands, the immunosuppression you need is same, right? So the if you look at the risk sort of benefit, we would give for a double hand transplant, there's nothing else you can do, and then they need it. So there's no problem in accepting the issues. But for a right-handed person losing right hand and you cannot adapt with the left, again justified. So unilateral hands can be done. It has been done across the world. You're totally psychologically upset, you can do. But for finger and all, I wouldn't. So that is how we titrate we counsel the patients so well in the way that it takes at least 4 days for counseling with different people. so that they understand the enormity of the process they
Yeah.
are going to undergo, and then only you. And then we don't accept the small things. Again, last thing is that you should be doing these transplants, even like there are face transplants, only when you have exhausted and your reconstructive methods are not good, right? For double hands there is no reconstructive method,
Yeah.
so there you use it.
Okay. All right. Yeah, so we actually turned down those people. We explained to them, then we
Yeah,
gave them
yeah.
your contact number. Um, in general, I mean, I was going to talk to you about counseling, but you already spoke about that. I remember after the transplant, somebody actually, one of the transplant coordinators in a conference got up and said that, when we ask for organs, it's one thing. So, but when we ask for hands, they're like, you take everything, but not the
No,
hands.
not that. Yeah, yeah.
Very tough. And like you said, this first donation really kind of broke the ice, and now more and more people are coming forward for this. um, there is no national registry of hand transplants. If somebody needs to get onto a like a registry, who do they reach out to? They have to go to these five hospitals that you mentioned.
They have to go to the hospitals for registration. They have to be counseled. They have to be screened and counseled. You need to look at the antigen level, PRA level, whether they have a lot of inborn inherent chance of risk of rejection. All those things you have to do it, and then you have to get registered. But once you get registered, it goes through the Soto, and then
The government
Roto,
agencies,
and
yeah, the
Noto.
nodal
So
agencies.
then it becomes a national thing. Now, nationally, organ donations are happening, and then there are certain people who are interested in promoting hand donation, and it is happening. Like, so, there, this once it is registered, it automatically comes. So any person who wants to get it done have to go to these centers.
All right. So there is, how are the recipients doing? I just wanted to talk about the actual surgery. How are the recipients doing? Are they doing well? I know I have spoken to several, and they seem so happy, to have their lives back, because life without hands was debilitating. It was
Yeah, yeah,
hopeless.
yeah. Correct.
And the hands have to be used every day, all the time by the recipient. So it must be also a very complicated surgery. I mean, if you compare it to other transplant surgeries, how complicated is it? How difficult is it?
I will show you a single picture which will show you how complicated the. Let me share my screen. It may take a just a minute. Yeah. Now, if you look at this slide, um, I hope you can see the slides now. Yeah.
Yes, yes. Oh,
Yeah.
wow.
See, this is the cut surface of a hand at the wrist level. So you see the enormous number of structures. You have just briefly I've mentioned as 25 tendons, 6 nerves, 2 arteries, 5 veins, 2 bones. So all these have to be connected. I'm not saying that, see, liver transplant or heart transplant, lung transplant, they are all technically easy or anything. No, they are technically challenging, demanding, and it's a question of life and death there. But when you come to the hands, the meticulousness of the that is required to connect all these things, and without, imagine, then I'll show you some pictures later,
Mm,
where you will see that you have to connect each and every one of them meticulously, and then these blood vessels are the ones which are going to support your the what you call the make them live there. You need a microvascular procedures, and then you need to have expertise. It takes
yeah,
time, so that
right.
is how it is complicated.
So how how many people are working on this? I mean, what does the team look like? It's so many things being connected. There
Yeah,
must be a lot of people, who are a part of it.
I will again, with your permission, just go
Yes,
back to the
yes,
slides and then
please.
take you to through some amount of how do we do it. Let me come. Yeah, this is the PowerPoint, right? Yeah. So if I, what are the steps in transplant? I will see now. First of all, the hand is procured from a brain dead person. It has to be brain dead person. When I talk to you, this slide is very important because I just want to convey one idea. See, this is the hand that is being taken from the donor, and this is the hand that is being packed. The second picture is the one which is it is packed in ice and then transported to the a place where the body, recipient is being operated. Now, the third picture shows the most important thing about the mutilation, what I say. So, when we counsel, we always tell the family that we are taking the hand, but we will give back this one. We'll give back a look alike type of processes which can be fitted immediately as soon as So when you get the body won't look mutilated. So it will be given like this. So that makes a lot of difference. And then we have found that in all our donor families, they have not felt anything bad about seeing the body after hand donation, because they get the body back in a reasonable shape of non-mutilated way. Now, once this hand is taken, as I told you, I showed you that picture, the number of structures. See,
Right, right.
all these blue tags are those structures. You have to take each number, each one out, and then see, it is written median nerve, it is written FDP is a tendon that moves. So each each structure is tagged like this, and at the same time, the recipient of the hand is prepared in the other OT, where two teams will work on both hands. They will expose the whole structures like this, again tag it, because see, when you come and connecting together, you cannot search
Yeah,
for any of these
yeah.
things. So you
Mm-hmm.
tag them, and then you connect them together. First the bones are connected, and then the arteries, and then veins, and the nerves, and the tendons. And it takes about, see, 15 to 16 hours. This video will show you something like the what is the this is a real video of the first hand transplant surgery which was happening. You can see the entire, the theater full of people. They are full of nurses, full of doctors, surgeons, anesthetists, orthopedic surgeons, plastic surgeons, working under the microscope. So each person is doing their own job. So this is the hand
Yeah.
being prepared on one side, and on the other side the hand is being prepared on the donor side. So these are all happens simultaneously, and it takes about 15, 16. See, this is the hand that has been being prepared, and then you connect all these tendons, and then connect under the microscope. You work on the vessels, and see, this is the operating microscope where you work
Mm-hmm.
on.
Wow.
So, and then this is the I just want to show you
Yeah,
that
that was
what
my
that
next question. That how
oh,
are they
okay,
doing?
okay, okay,
How are
yeah,
the
yeah.
recipients doing, and how long does it take to for them to kind of, get
uh,
back to regular life?
yeah, I will see this one. This picture is just to show you in that those 16 hours you could transform. This is our first hand transplant patient, Manu. So he was like this before, and then within 1 week of the surgery, he was drinking on his own with the hands of the donor. So now, don't think that it all happens just like that. In Manu's case, it was at the hand level. So the forearm muscles were working. Whereas in other people, if it is a forearm or upper arm, it takes some more
Much
time.
longer. Mm.
Yeah. And then you ask me the question, what do they need after that? They need quite prolonged sort of physical medicine rehabilitation. See, this is Manu doing his physical medicine rehabilitation exercises. This is 1 month after the transplant. See, and see in 6 months how efficient he has become. Now, no,
Wow.
people
It's
who are
amazing.
watching, see, just tearing the paper. See how much time does it take? He can't feel
Yeah.
much.
Yeah.
He can't feel that the feel of that. See, but 6 months, see the way he does, and putting the peg in the hole. It is a delicate sort of intricate thing, which it was impossible after after the 1 month of transplant. But now you see 6 months is able to. So that much of regaining of the function occurs within those 6 months. It takes about 1.5 years of 1 to 1.5 years of rigorous exercises to
To get
get
full
into the
function.
get the function. Yeah.
Yeah, and otherwise after that you have to keep exercising, and you have to after once it's come, it's come.
No, yeah, yeah. Once it is come, it is okay. Manu and all. See, it took
Yeah, I
one
have
year,
met him
but
as well. Yeah.
yeah, but after that's perfectly okay. They are really normal. See,
Okay.
yeah,
Wow.
I'll stop share and then yeah,
Nice.
one
Nice.
minute. Let me get back to it. Yeah, 1 minute.
Yeah. So there was one question: can lower limbs also be transplanted? I mean, that was something that even I wanted to know. I mean, you talk about
Yeah.
hands, so hands are being done. What about legs or
I
feet?
get a lot of questions, a lot of queries, and
Yeah.
a lot of emails regarding this. But the single word answer is no. The reason I will tell you, uh, the hands have got intricate functions. You each movement is quite intricate. Whereas imagine your legs. Legs need just a stable platform. You need sensation to know that you are walking on the ground, and you need a bit of plantar flexion and the movement. That's all. And the main thing which the leg wants is a sensory return. You should feel that you are putting your legs on the thing.
Yeah.
But
Yeah.
for a leg transplant, the thick skin of the legs doesn't allow that sensory return to come. So even if you transplant, the actual use of that transplant might not be brilliant. But at the same time, the prosthetic legs are so good. People have climbed mountains with prosthetic
Okay.
legs, right? So, which shows that prosthetic legs are so good. So, but in the hands, you are competing with prosthetic hands, which are expensive, and then it doesn't allow you to do much.
Yeah, so that was my next question, that would you, this prosthetics versus transplant.
Yeah.
So why would you think transplants are better? Because they give you more movement and more sensory.
See, prosthetics, first of all, they are quite heavy, and
Yeah.
then they have some movements. They give you movements. There are a lot of varieties of processes now. I'm sure in years to come there'll be more robotic driven sort of prosthetic things are there. But at present you have myoelectric processes which allows you to move your fingers with the this thing. But the main disadvantage of prosthetics is that it is heavy and it cannot touch water. It doesn't have sensation.
Of course,
So
yes.
I'll show you one just one video here where our transplanted he was doing this one. Let me see. Yeah, you look at this one. See, look at this video where you can see our
I,
see this is a person who had a transplant who is swimming. But
Dr. Ayyub, it's not visible
oh, I'm
right now.
sorry.
Yeah.
Sorry. Why is it not visible?
Yeah, I did speak to somebody about somebody who did have prosthetics, and it was so heavy, and
Yeah.
she said she couldn't, this was not manageable,
Y-
and half the
y-
things she couldn't do in any case, even with the
yeah,
prosthetics.
two of those. See, Shreya had that upper arm transplant. She was using processes, and then she was
Yeah,
definite that she
he
cannot
was saying,
do with the
yeah,
processes. So we always suggest that why don't you try the process first, before jumping into transplant.
yeah.
That is our usual sort of way of counseling, if possible.
Okay,
But
yeah,
prosthetics are expensive, and then they can go wrong. And then so everything is there. All issues are there. I'm not saying that hand transplants are just simple to do or maintain. No, it's not that.
no,
But when
not
you
at all.
compare
No.
this thing, yeah, it's not.
All right, okay. So there's another question which I think you've already answered. Patients need to take any immunosuppression or not? Yes, of course.
Yes, yes. It's just like a kidney transplant. Usually, we do the when the patients are being transplanted, we give them heavy immunosuppression for about 5 days, so that there's no acute rejection. And after that, they are given continuous medications every day, lifelong, with three or two drugs. Some people give steroid free, some people give minimal dose of steroids. It's just like kidneys. You need to take lifelong immunosuppression. If you stop that, the hands can be rejected. But the
Okay.
good thing about hands is that, see, rejection episodes occur in hands, but they can be visible, so visible in the hand. It comes
Okay.
as like a scratches or mosquito bites type of thing. If you see
Okay.
widespread, you feel that there's a rejection.
All right. So you can tell fast if there is a
And
rejection.
then you take some medicines and then prevent it from that rejection to go
Okay.
off.
Yeah. Okay. So one question actually I wanted to ask earlier, which I didn't ask, was after the hands have been removed from the donor, after they've been retrieved, how long can they survive? Before you transplant them.
Yeah, there is something called cold ischemia and warm ischemia. You know, so if we take the hands from somebody, and then immediately we perfuse it with the ice cold solution of different solutions are there. We use University of Washington solution. So once it is done, and then the limb is covered with plastic sheet and then surrounded by ice. It should not be wet, it should be surrounded by the ice and then put in a box. This is something called cold ischemia, where the tissue metabolism is less and then oxygen requirement is less, so the chance of the tissue getting bad is less. But once it comes to the hospital where the transplant is done, you take it out and then start preparing it, and that preparation may take about 2 to 2.5 hours. So when you take it out and put it out and then do the preparation, it is something called warm ischemia, right? So this combined together, you can have about 5.5 to 6 hours, of 6 hours. It can go up to 7 to 8 hours. So that is a problem. When you transport something from somewhere else in the country, you have to be careful that you need to have a good transport mechanism for that. That
Yeah.
is the one difficulty which we are facing now.
Okay. All right. What are the somebody's asked what are the contraindications for going ahead for hand transplant?
First of all,
As a doctor, yeah.
when you counsel the patient for transplant, you have to be very choosy. You have to make sure that this is the ideal candidate for transplant. First of all, when we started, and we still continue the practice that we are doing only in bilateral hand cases, but even though all over the world unilateral has been done, it is not. Why we have a long list of bilateral hands waiting, so they should be given preference. That's why we are doing it. And then the cost benefit, I mean risk benefit problem, is also quite acceptable in a bilateral hand. So that is why we have been doing that. Now, then we have to look at whether the patient is old. I know, if the patient is less than 18 years, we are not in pediatric age group. Nobody has started doing transplants, but
Okay.
only in one case across the world it has been done. But that child had a kidney transplant, so he was already on immunosuppressant,
Already on immunosuppressants.
so it doesn't matter. So that is the only time. Otherwise, always after adulthood. Then congenital hands, you don't do it because of various reasons. One is that congenital hands, by the time they become 18, 20, they would have got used to it. Their brain would have used to it, and you don't add any benefit out of that. Secondly, the brain wouldn't have a representation for the hands. So even if you
Okay.
put the hands, it might not move. So it is very
That's,
difficult to say. So congenital hands you don't do, because this is often a question. No,
yeah.
question comes
Yeah.
from everybody. Then psychologically and socially and financially, they should be okay. That either you should support them lifelong for their medications, or they should they should have some backup. You should be really looking at critically at the suitability of that person as well as the social backup for the transplant.
Okay. So that's another question that I had, that you said that prosthetics are expensive. What is the cost involved in a hand transplant surgery? I mean, I'm sure it might differ from place to place,
Yeah,
but
different,
yeah,
different. There's
yeah,
a question
yeah.
also.
Somebody's
Yes,
asked that also.
somebody's
Yeah.
asked the question.
Mhm.
Yeah.
Mhm.
See, it depends upon the hospital to hospital. I can tell you, ours is a private charitable type of hospital, university teaching hospital, where there is treatment is to some extent subsidized, and then even there, the cost will come to around 20 lakhs, I would say, for about the transplant and the month's stay and medications. And we say that in government hospital like Stanley and Jipmer, it was free of cost. AM, it was free of
Oh,
cost. So
amazing.
government hospital might be free of cost, but then you have to think that you have to spend about 15,000, 10 to 20,000 initial 2 3 years, and then about 10,000 every month. Every month, I'm talking about every month
Yeah, for
for
the rest of the
the
life.
medications and the tests, lifelong. So that also we need to look at it.
Yeah, yeah. All right. Somebody's asked yeah, so
Upper
do
hand.
face transplants. Somebody has asked, do face transplants involve multiple surgeries, and how long is the recovery period? Also, we are not doing face transplants right now in India.
No, not yet.
Right. Yeah, yeah.
Yeah. See,
Any
face
reason?
transplants, about 40 have been done across the world, and most of them have been in France and US, and one in couple in Turkey. So what face transplant is has been done in most of the cases are mainly because of the accidental gunshots, suicidal gunshots, and injuries, and then uh, bare mauling the face, and neurofibrosis, all those things. The face transplant is a single procedure, but it is a slightly more technically challenging because you have to see, it is not same. Hand transplant and face are almost equal in the technical challenge, but then to get a face taken out is a problem. No, it doesn't just, hands can be just cut off and taken, but face has to be critically, it takes about a few hours, for 3 4 hours to take out the face even. And
Plus,
then
to get somebody to donate is also
that is going to be
going to be
very very difficult. No,
even more
even
difficult.
so we
Yeah.
have been uh, we have technically been prepared and mentally been prepared. We are waiting for we are looking at the ideal sort of recipient. In a way, if they come, we might consider it, but then the greatest challenge for us would be of finding a donor. It will be a problem. But
Yeah.
face, especially, you should do it only after doing the multiple surgeries. I think when the person asked was might be regarding the previous surgeries. You should have a multiple reconstructive procedures, and then you should find that it's not suitable. Then only you should go into face transplant.
All right. And how do you see hand transplantation and limb transplantation happening in the future? Do you see it picking up?
It has been picking up since 2015.
It has.
We have found that five others, no, yeah, two plus three, 2 plus 2 4, and at least four centers, and then another four centers in the country are ready for transplant, hand
Okay.
transplant. So that is definitely a progress there. One. Secondly, the number of people getting transplanted is also getting higher. The donation of hands is also slowly picking up. People know that it can be donated, and then when you look at the right families, they in fact do not have much problem now. If you are telling, they still, I will say 50-50. Initially it was 1 in 5, now it is 50-50. You might get it across.
Okay. Yeah.
So the future of hand transplant, now looking at the picture, we have been we have been visited by a lot of people across the country. mainly from North India. Then because of the electrical injuries in the agricultural fields and all those things, you lose both
Okay.
hands. Rajasthan, you have a lot of people, like that. Then we get people from Middle East, Malaysia, Sri Lanka, Pakistan, and Afghanistan, those places where there's a Syria. We have done a Syrian patient. He was a young fellow who lost both his hands in a mine blast. Poor people. See, I saw one patient with both hands lost, both legs lost, and both eyes lost. And this
Oh,
he's young, engineer, and then see, that's the way of the things we see sometimes. And then so when you see this number of people, and then you look at the prosthetic things and all those things, maybe the hand transplant, even if you give them 10 years of life, you imagine you have issues with the medical immunosuppression and all. But when they have unsupported life of their own, for maybe your life's number of years might have come down, but still, if you ask each of them, they will say that I want
yes.
that. So
Yeah.
that way, the necessity of hand transplants is also increasing, becoming people becoming aware. It is more and more. So more and more people are getting interested, and then so I'm sure there'll be a good future for that.
Oh,
And then
great.
immunosuppressants are, research in immunosuppressants are also going in a hectic pace. So some stage your amount of immunosuppression needed might come down.
Right.
So it can make it much more safer. So then it is better to be equipped very well and prepared for that. No, no. So yeah,
Yeah. So there was one question which you've already answered, but we can just talk about it again. That is, what do you do to the donor's hand? I mean, those hands that are taken off, do you replace it with prosthetic? So that is
yeah,
what you do.
yeah,
Yeah,
yeah.
you replace it with
I
prosthetic.
showed you that picture.
Yeah.
This is something always we have to tell you lead a lot of training sessions, and the coordinators and counselors should understand that we never leave the mutilated. And see, we make sure that when we go for a donation, somebody stays back. And then if there is a post-mortem, we don't want the hand to be, the prosthetic hand also to be not placed properly. So somebody stays back and then make sure that the body is given back in a very honorable way. So it doesn't cause too much of problem.
Right. Right. All right. So, Dr. Iyer, November 27th, in 10 days, is India's Organ Donation Day.
Yeah,
Do you have any message
I will
for our
show you
viewers?
one picture. I
Yeah.
will show you one picture. How? One. Let me see if I can share one's last one. Let me see. I just want to see. Is it?
No, you've shared something, but it's blank. I don't know
Is it
why.
coming? No,
Yeah, it's
no.
coming
Is
blank.
it?
Yeah,
Is coming?
it's not coming.
Is nothing is
It's
coming?
no,
Nothing?
no. Is it a video that you're trying to share? It's a black
Is it
screen.
there? You can't see
No,
that, is it?
no.
No, there's something wrong with the streamline. Okay, okay. I just want to show the. Is it something wrong with my sharing thing? Is
What
it?
is it that you were trying to show?
I just want to show you the. Let me try
You
once
can share
again.
it. Yeah.
If it comes, do you see anything? No,
1 second.
no.
Yes, yes. Now we see it.
Now you saw.
Yeah,
Yeah,
yeah.
I just want to show you this one. Can you see this?
Yes.
Yeah, this is the first and second hand transplant of the country.
Oh,
Manu
oh,
and Abdul,
both are hand transplant recipients.
both the hand transplant
Wow.
recipients,
Mm,
after the hand transplant, they are enjoying a day out.
right.
Imagine, without those hands, would they have been able to do this? So, this is what I just want to part with as a last sort of photo where you are restoring, sort of giving back life. Not, I wouldn't say that it is like a kidney or liver or anything, but you are giving back life to young people. And Abdul, to, for your information, he was a he was a Afghan army soldier who was a captain who was diffusing mines. His job was, and then while he diffused mines, got blast, and then he came here. After his 1 year, he went back to Afghan army, joined the army. He was promoted, and then 5 years later, while working in the army, he was killed in an ambush. Right. So
Oh,
he see,
very sad.
but whether whatever is that, it's a sad thing, but he went back to his normal what he wanted to do in his life with those hands. So that is what I think. See, what I just want to part with this message, that organ donation, see, these are all happens only because of some person, some people uh, decide that the person who has been dead, their near relative and whatever is that, at that moment of grief, they decide that this person's organs have to be giving life to other people. So when that sadness, sorrow of that loss of the person becomes the joy of other people in their life, that is something which nothing else can give, nothing else can give you. So that is something which we should know. And then, Sunaina, you are all doing great job by promoting this, people,
Thank you.
that way. So I think that is a something, being a catalyst to this noble deed itself is something what you call punya. So I'm sure what you all doing is the greatest service to the humankind now in the country. Thank you.
Thank you so much, Dr. Iyer, for joining us today and for your incredible insight into hand transplants and for the amazing way the work you do to transform the lives of all the people. I would like to tell our viewers that if you want to know more about hand transplants, you can email Dr. Iyer at hnscoordinator@aims.amrita.edu. So that's HNS coordinator at the rate AIMS dot amrita.edu. So that's where he can be contacted. Thank you so much, Dr. Iyer. Again, thank you so much for
Thank you.
spending almost a whole hour with us and explaining everything to us. It was really, really very amazing and very educational. Thank you so much.
Thank you. Thank you, Zenathan.
Thank
Bye.
you.
Okay.
Bye.
Okay. Bye. Bye.